know your PCOS type? If you don't worry, it's actually not that important. So if you're someone who's come across a social media post, a video, or even a quiz urging you to discover your PCOS type in order to heal, and maybe you felt unsure if it applies to you, maybe you were confused about what type is best for your situation, or maybe you just felt overwhelmed across the board, today I'm gonna share with you 3 important reasons why PCOS types are not as important to your healing as you may have been led to believe. Let's do this. Okay, so the first thing we want to understand is that PCOS is a syndrome, and there are a variety of symptoms that can happen, and they very much can differ from person to person. So everyone's PCOS is going to look a little bit different, and that's different than, say, diabetes or hypertension, where most people with diabetes have high blood sugar. Most people with hypertension, all people with hypertension, have high blood pressure. Those are things that are stable and the same across the board. But with PCOS, that is not the case. One person with PCOS can struggle with weight, cravings, and fatigue, while another person can struggle with totally different symptoms, maybe excess hair growth and missing periods. So right off the bat, putting both of these people with PCOS into categories and lumping their symptoms together is not a great idea, right? Because there's so much variety, there's so many different symptoms, and everyone is going to manifest PCOS in very different ways. And this is why, by the way, some people don't fit into any of the 4 common types that are used, and some people fit into all 4 types, and that just adds confusion and overwhelm, but when it comes to managing your PCOS successfully. So there are 4 different types that are commonly used: insulin-resistant PCOS, adrenal PCOS, post-pill PCOS, and inflammatory PCOS. Now, they can give you a general direction, and if you're just getting started, it's not gonna steer you wrong for the most part, but again, it can really box you in and prevent you from seeing the bigger picture of your PCOS. And so this is why I personally don't recommend them. We're gonna break it down further why those PCOS types can be problematic, but I want you to understand that yes, they can give you a general direction, but if you're really looking to manage PCOS successfully, you don't wanna be too caught up in those 4 types. Okay, so let's dive into the 3 main reasons why I don't like to use PCOS types with my clients. The first reason is that your PCOS type can change over time, it can evolve, and there could also be overlap of symptoms and types with PCOS. So this is pretty common, and it makes total sense because the same hormones are working under the surface, and they can cause different issues, or the same issue could be the result of 2 different hormonal imbalances. So the way that your symptoms show up doesn't really tell us much about what's happening under the surface. We need to dive deeper. And the most common example of this is weight gain. So let's talk about weight gain. Weight gain with PCOS can be the result of both inflammation and or insulin resistance and even high androgens. And so these are 3 different hormones or 3 different underlying conditions that can categorize you into different types, but the same symptom is what is showing up for you. And that means that weight gain, just by looking at that symptom, you cannot really know your type, or you cannot really know what's under the surface. And that's a really common problem with PCOS types. So they could steer you wrong, they can blindside you from what's actually going on, and they can just get you down a path that's not necessarily looking at the true cause of that symptom. When you get too boxed into one type versus another, it can really delay your healing. It can make your journey to better health longer, and we don't want that. Not to mention, your PCOS type's symptoms and hormonal imbalances can change over time. So when you're in your teens, 30s, and 50s, you're gonna see very different PCOS manifestations. You're gonna see different hormones come into play. And so your PCOS type would likely evolve over time. But again, if you took a quiz and you thought that you were insulin resistant, and maybe over time your insulin resistance improved because you changed your nutrition and lifestyle changes and you were able to reverse it, now you're too boxed in and you're not being really aware of the bigger picture of your health and what's happening as you age, as your lifestyle changes, and as your hormones shift, which they normally do, and that's a natural process. So again, don't get boxed in. Don't worry about the PCOS type so much. Look at the bigger picture of what's happening, and many times there's an overlap of multiple types. And so we want to make sure we're not being so narrow-minded about it. The other reason I don't like relying on PCOS types is that they're based on the surface level symptoms. They don't really go deep. And so I want you to think of PCOS like an iceberg, where the tip of it is what you see. Those are the visible signs and symptoms like acne, weight gain, maybe you have skin tags or discoloring of the skin, which is also related to PCOS. But under the surface, what's happening is way bigger. What we see is just one small part of PCOS. What's under the surface is the big chunk of the iceberg, and that's where your hormones and your PCOS drivers and everything else that's happening in your body contributing to PCOS. So there are a lot of different things that are involved under the surface: your medical history, your lab work, your family history, your bigger picture of health. And so when we're talking about PCOS types, unfortunately, we're only looking at the surface level symptoms, which are often subjective and not taking into account what's the root cause of those symptoms. So for example, many women with PCOS experience irregular periods, and this could be the result of high androgen levels or excessive stress or inflammation. The same symptom can have different root causes, and PCOS types don't really distinguish between those various things to truly help you understand your PCOS problems and come up with a plan to address them effectively. And so we need to look at the bigger picture of your health, and that includes things like your medical history, your blood work, medications that you're taking, your family history, what hormonal profiles you have, right? There's so much more to it than what we see on the tip of the iceberg, that surface level symptom. And most PCOS types, quizzes, and other videos and other resources that you may find rely on that little tip. And again, this is not showing you the big picture. It's not going to give you that deep dive into your hormones and that true long-lasting relief from symptoms that are bothering you. And then the third reason that I don't love PCOS types and I don't really use them in my practice is that some of the types are a little bit questionable, or shall I say made up. This is a little bit controversial, but I want you to stay with me. Here's the thing. I have a particular problem with things like post-pill PCOS or adrenal PCOS, and here's why. So post-pill PCOS is often diagnosed or used when someone comes off birth control and they're not getting a period, right? So then they assume that the lack of periods is related to the birth control, and that birth control gave you PCOS because missing periods are common with PCOS. So there are a few issues with this, okay? When someone comes off birth control, hormonal birth control, it is common and normal to experience a delay in getting your period back. That is totally okay and normal. Of course, we want the period to be restored, but this transition can temporarily mimic PCOS symptoms, again, like missing ovulation, missing periods, etc. But it does not mean that the individual has developed PCOS as a result of taking the pill. This is due to the suppression of your own body's hormone, the suppression of ovulation while you were on the birth control pill, and it can take 3, 4, 6 months sometimes for your body to resume ovulation and for periods to return to being normal. And this transition, this delay can happen for people who don't have PCOS either. So it's not that the pill gave them PCOS. They didn't develop PCOS when they came off the pill. That is not the case. Not to mention, a lot of times women with PCOS go on the pill, go on birth control to have a regular bleed every month because their periods were missing and irregular. And so that issue was there before they took the pill. And so certainly birth control pill does not cause PCOS. It does not cause missing periods. This is a normal process when you come off the birth control pill. There's a transition period and it can take a little bit of time. That is okay. And the same goes for adrenal PCOS, for example. So while it's common to see high androgen levels with PCOS, and some of those androgens, those male hormones, do come from the adrenal gland, it doesn't mean that this is its own separate category of PCOS and that the treatment should only focus on that aspect, because the condition is much more complex and broad than that. So it's best to stick with the widely accepted criteria for PCOS diagnosis, which says that you have to have 2 of the following 3 things: menstrual cycles that are longer than 35 days, high androgen levels, and ovarian cysts upon ultrasound. Any 2 of these 3 things would mean that you have PCOS. So my recommendation would be to not get too caught up with PCOS types. Let's stick to the widely accepted PCOS diagnostic criteria that I just mentioned. That's called the Rotterdam criteria. And let's leave the confusion, overwhelm, and kind of like uncertainty around PCOS types alone known. We don't need to worry about that. Those types can confuse you. They overlap, they change over time. They can cause a lot of delay in your healing. And of course, we don't want that. Okay, I hope today's episode helped clear up some confusion about PCOS types and help you understand why this is really not something I'd spend too much time focusing on, because it can really blindside you from what's truly important and what's truly going on in your body and just prolong your road to healing, which of course we don't want. If you want to learn more about your hormones, your PCOS drivers, and the root cause of your symptoms, definitely check out my recent episode called What's Happening in Your Body with PCOS.